Look, this is Dr. Tony. I want to answer some questions people have had recently about what we do. Okay, a lot of it is we want to make sure you feel comfortable coming in and answer this question beforehand, their objections if possible, so you know what to expect when they come in the door. All right, so I'm going to have Miss Nelly answer some questions that people most commonly do ask, and we'll go at it. Go ahead.
Okay, first question. Why should they see a chiropractor if they have chronic back, neck, and headaches?
What we do is basically treat the back via an x-ray. Right behind us is right behind the camera actually is our x-ray box. What it does is we take the x-ray in the office, right in the back room here. What we do is analyze it with you. You see what normal is. You see how yours is different. So if it's a spinal condition, we can rule things in, rule things out the same day. At that point, if it is a spinal condition that we do treat, we want to bring you back for an x-ray analysis. The difference is medicine will, first thing you're going to do is give you medication. Okay, you pick what letter you want to start with, Norco or Darvocet, Vicodin, it's up to you. That's the first thing you get in the medical office. You're going to spend probably 2 hours there. We get people in probably within 20-30 minutes. Okay, find out what's going on inside, especially chronic pain. Chronic meaning pain lasting more than maybe 3 or 4 days. Pretend that happened just today where you're doing something wrong. It has to be there for a while, meaning where it's not going away or the kind of medication isn't working. So we want to do is find the underlying cause, not just treat with medication, which is our first step with the x-ray analysis. Okay, second question.
What will happen if they ignore this pain and just keep taking pain pills?
What can happen is the problem can actually get worse. Okay, I have a lot of problems where someone has been treated with medication for a minor back injury, and over a period of, say, weeks and months, that minor problem becomes a disc or nerve issue. So we can actually cause a disruption where a wait-and-see method with just medicating the problem can make the problem condition worse to where it becomes a muscle strain, muscle sprain, to a disc nerve problem, and to require shots or a long-term care versus dealt with initially with an x-ray exam and also chiropractic analysis. That may be fixed right away versus waiting 2 or 3 weeks and then taking months to get better. Let's go to question number 3.
In your experience, why don't people go to a chiropractor right away?
Why do they go to chiropractor right away?
Why don't?
Why don't? Because we're all used to our comfort level of seeing your medical doctor first. And most of us were born in a hospital, and that's our first experience. And when we're kids too, we get sick, we go to the doctor. We go to the medical doctor, we go to urgent care, we go to the emergency room. So going to a chiropractor is not the normal thing to do. Most people don't realize we treat problems without medication, without surgery. That's our number one thing. So if we're going to do that, treat it naturally, we look from the inside out, see the spine first, and see what's going on in the spine, and treat things and without causing medication to become an issue if it's possible. So realize people do that because that's their comfort zone. And if they realize, okay, I don't want medication, I don't want surgery, I don't want someone to tell me wait and see what's going on, I'll take care of it now. That's what we do is we see people like that. All right, next question.
What are some things people don't know that a chiropractor can help them with?
What we do, and I thought about this question before too, I've been asked many times, we help people realize their nervous system is their stress system. Okay, when your nervous system is off, and that's what we treat the spine, we treat things back here, treat the actual nerves, is we get things to calm down. Most people are too stressed, not under stressed. Because they're too stressed, the spinal nerves, when they're being pinched by the actual bones or disc problems too, they make the body overstressed. Not just the back of the neck, but those nerves go to the brain, those go to your adrenals, make your overall hormones, which go to every part of your body, stress the whole body. So our job is to de-stress the body. So someone's symptoms of maybe back pain, but secondary system of not being able to sleep, we help to sleep also. Not be able to, for example, they may have anxiety because of that, we'll bring that anxiety down. We help the body deal with stress better, give them higher tolerance to stress. That's the number one thing we treat beyond the back pain or neck pain. Okay, next question.
What motivates a person to make an appointment at a chiropractic office?
The number one motivation I've seen over the last, say, 15 years been in practice is they want to get off the pain medication. They've done, I think it was number 2, where they've come to doctor, trust your doctor with, take care of this problem, but hasn't seen results. They haven't seen the benefit of the symptom being reduced, maybe pain or numbness, whatever it might be. They come in because, okay, I've tried that, that's not working, let me find something else. Sometimes they've been under care with a medical doctor for months and they're taking an x-ray. We take x-ray the same day. We want to make sure what's going on inside the spine first before we do anything with you. Make sure it's one thing safe, something we do fix. So one thing again is probably more the pain medication. Another thing is going to be a personal referral. More than half, about 60% right now, of our new patients every month come from patient referrals, meaning a friend, a family member, a coworker, whatever it might be. That gives us, if you want to call it, an inborn trust with that patient before they walk in the door. That gives the ability to help them because they'll at least listen to what we're doing and give us the chance to see the x-rays with them and give us an idea of what's going on with their body because they come from personal referral. Okay, any more questions?
That's it.
That's it for today. We'll talk more down the line, more common questions we have, and it's going to help people understand what's going on, and hopefully you understand what to do and what to know before you see a chiropractor, right? Hopefully we do get to see you soon, hopefully, or another chiropractor in your area. Enjoy health from the inside out, and have a great day, and thank you for all the reviews and comments on these videos.